According to the CDC, people with the seasonal flu are most contagious in the first 3 to 4 days after the illness begins, but may be able to infect others beginning 1 day before symptoms develop and up to 5 to 7 days after becoming sick. At Pomona Valley Hospital Medical Center, we spoke to Dr. Eric Sechrist, who gives us information on who is more at risk for serious complications.
So the flu is a seasonal respiratory illness that's caused by the influenza virus. Typically, people will experience high fevers, congestion, cough, runny nose, sore throat, body aches, and fatigue, and usually throughout the fall and winter months.
When should someone seek medical advice for flu?
Most people experience rather mild to moderate symptoms, ranging from a few days to under about 2 weeks. Usually done best managed at home with plenty of rest, drinking plenty of fluids, taking Tylenol or Motrin as needed for the fevers, aches, soreness, things like that. Those that should seek advice from a medical professional would be those that are experiencing chest pain, difficulty breathing, not eating or drinking very well, more lethargic, confused.
The flu can be dangerous for at-risk people.
For the majority, it's a self-limited illness. It'll usually go away on its own. For some, usually those with chronic medical conditions, asthma, COPD, heart attack, people on dialysis, diabetes, elderly, those that are pregnant, or young children, can sometimes be more prone to complications from influenza, such as pneumonia and things like that. And in those cases, flu can be serious and even deadly.
There are definite ways to prevent getting the flu.
Most important thing for flu prevention would certainly be the flu vaccine. CDC recommends that everyone age 6 months and older should get a flu vaccine. Other important things would be, hand washing with preferably soap and water or alcohol-based hand sanitizer. Certainly covering your mouth and nose for those that are coughing or sneezing, and certainly avoiding sick contacts as well. Those with influenza or a flu-like illness would certainly be advised to avoid those people. That's really the worst part of the flu, is having the fevers, the body aches. You just don't feel like yourself. You feel achy, fatigued, run down. You just feel miserable. So, it's really just managing those symptoms until your body can get rid of the infection on its own.
Dr. Sechrist gives advice if you come down with the flu.
So my advice to anyone who is getting the flu or has got the flu would certainly be, stay at home, get plenty of rest, drink plenty of fluids. Again, Tylenol or Motrin as needed when you're feeling the feverish, body aches, soreness and things like that. Some over-the-counter medicines, the Dayquil or NyQuil, may help with some of the cough and congestion as well. In certain instances, you may want to seek advice from your physician if you're, experiencing, severe chest pain, difficulty breathing, if you're noticing signs of lethargy, confusion, other things like that, not being able to eat or drink. Certainly in those cases, want to make sure that there's not anything more serious developing, like pneumonia. And in some cases, medicine and antiviral like Tamiflu may be recommended for some of those that have other medical problems, young children, elderly, or those that are pregnant.